So that is actually potentially amplifying
Absolutely.
how our bodies then cope with other real world stresses.
Exactly. And kids, especially under the age of 3, they are learning how to read a face, right? So if you have a mask on, if you're covering half of your face, those children are not assimilating what your eyes, what your forehead, and what your mouth are doing all together.
Essentially, that means that we take a bilingual potential and make them unilingual.
Yeah.
Which is a discredit to the body's capability. Well, good day, folks. How's everybody in the world today? You're on the Dr. Chapa Wellness Show, where we love to bring you information to change your world, to impact your families, to make you live better, be better, and stay better, one bite at a time, through lifestyle practice and beyond. And today, I have the great Dr. Farella. She is in the house. How are you today?
I'm doing amazing.
Tell us the name of your company, because I just like how it rolled off of your tongue.
A Brighter Tomorrow Family Health and Wellness.
Yes. And it is a brighter tomorrow when you choose to take the bull by the horns. And I think too often we have people that don't realize that it's their life, their health, and their choice. Wouldn't you agree?
Absolutely.
And
absolutely.
When did you come to realize that we have a problem in the way medicine was leading people towards a brighter future tomorrow?
I think really, honestly, I've practiced very differently from the beginning. So I saw the problem in my residency, day one, square one.
Oh, give me an example, if you don't mind.
Yeah, no, it's totally fine. I actually went to school offshore. So I was learning things in the island way, so to speak. I was in Dominica, West Indies. And so we didn't have a hospital. It was our hospital was... you have more tech in this building right now than we had in a hospital. Yeah. They had one respirator, and that was for surgery only. So just to give you an idea. So, we learned very, very sharp clinical skills out there because that's all you had. We didn't have lab work. We didn't have anything like that.
And sharp clinical skills essentially would be like just being able to read the signs of the patient.
Yeah, like taking a pulse properly and, understanding signs and symptoms and how to put that all together, things like that.
I'm already fired up.
So when I came back to the United States, I did rotations all through the United States. Baltimore, Washington, D.C., Long Island, New York. Actually, it was Jamaica, New York, out in Kansas City, Missouri. So, I saw the way things were done all across the country in different snippets, which I thought was amazing.
Great education.
Because as I go into my residency, you go into an institutionalized program where many of their people went to school there and then just stepped into the residency program there. And so we have, there was quite a bit of difference there because I wasn't really used to that, where it's our way or the highway. So as you could probably imagine, I was a thorn in some people's side because I was like, well, have you ever thought about doing it this way?
Yeah, because by now you've seen a ton of stuff.
Yeah, and they were like, we don't do it that way, here. And
well, it's interesting that, right? Because they say, we don't do it that way here.
Yeah.
It's not that there isn't another way. Because I remember my dad always taught me there's more than one way to skin a cat.
Exactly. That's what I used to use all the time there.
And they get upset about that.
Exactly.
And yet here we are, realizing that not only is there a different way, there is a better way. And so was there like a moment in that where you just said, oh my gosh, this is way off and I'm going to be stake in the ground different as a practicing doctor in the country?
Yeah, it was really unusual because I didn't understand why they were so close-minded. Why? Case in point, first year of residency, literally within months. When I was in Baltimore, we used to pull up steroids, Kenalog actually, pull it up, pop it into a nebulizer and nebulize the steroid for people that are having respiratory distress. We did it all the time. That was no big deal. So when I got to Texas and I said, hey, do you have Kenalog? I'll just pull it up and pop it into the nebulizer. My attending almost had a heart attack and it was like, you can't do that. I'm like, no, you can. We do it all the time. We used to do it all the time on the East Coast. Sure we can. No, you can't. No, you can't. No, you can't. Okay. Literally 2 months later, Pulmicort came out. And I was like,
gosh.
see, yes, you can.
But now we have a drug that allows us to do it.
Right. Now we have a different means because now it's a product that is marketed. So now we can use it. So right there, I mean, that was first out of the box, just crazy stuff like that. And so,
well, I think as as a student, as in the residency now, I mean, at this point, you're semi-colleague-ish. I mean, basically, they just figured out a way to get free services for many years, right? But outside of that, you're becoming a thinking clinician and asking questions, and immediately, if it bucks the system in any way, it's a no-go for launch. Like it just can't. There's no rationale of possibility. Like you obviously saw it was working, and now 6 months later, after you were telling this guy had. That showed where he was at on his trajectory of thinking outside the box and being open to options, right?
Absolutely.
Okay, so when you have been a frontline doctor since COVID,
correct?
And since COVID, we have seen a massive shift. And I think it's always possibly been there, but for sure, there's a massive shift in the word stress and anxiety.
Yes.
And how have you seen like stress affect our culture post-COVID now that we're post-COVIDians?
Well, it's really interesting because there's good stress and bad stress, right?
Yep.
So the problem with isolation as a human being, that's really bad stress. Just take that. So you saw how people on social media were going literally crazy. You can watch them just deteriorate over time.
Yeah.
And then, life as usual is really not life as usual because things have come into practice now that is different. That was way different than 2019, right?
For sure.
So I call this welcome to 2020, 4 years later. That's literally what I call this time period.
Awesome. Yeah.
And so when we're dealing with a lot of different things. We're dealing with, especially in the children, because I'm a pediatrician by practice. One of the biggest things I kept saying was get the kids socialized. You got to keep the kids in school. You got to keep the kids on the playgrounds. They had caution tape around playgrounds.
That's crazy.
And I couldn't even fathom the idea. So basically my house became the playground. So we basically invited all these different families over, let the kids be kids, let the families interact as long as, we were not in the fear mongering stages at all. I was like, this is ridiculous.
Sure.
I lived in the Caribbean. You want to talk about weird stuff that comes up? I saw cutaneous TB. I mean, like wild stuff that you'll never see in this country. And so they didn't do things the way anything was going on in 2020. I was not trained to hide in the corner, suck my thumb, and pretend that the world wasn't around me. This is disease, right?
I like it. Yeah.
So I opened the door and I said, no, we're treating people. Just come on in.
We'll figure it out.
Come on in. We'll figure it out.
Yeah.
I might not all know everything, but at least I'm willing to try.
Absolutely.
And so respiratory disease, I know how to treat respiratory disease. Kids are just giant snot mongers, right? For the most part.
That's exactly right.
I mean,
some of their parents.
Yeah. So that's a pretty easy thing for me to take care of. And so I was nipping that in the bud without too much issue. But what was happening was people were walking into my office not knowing what to expect, fully gowned.
In hazmat suits, practically.
Basically, gloves on their hands, masks on their face, standing outside, huddling their kids. I mean, just projection of fear everywhere. And I would tell them, look, if you're comfortable, take off your mask. I mean, it's not helping you, honest to goodness. And it's making it worse. It's making you worse. It's making your kids worse. Your kids can't see your face. They're not learning your signs and signals just from your facial expressions. This is really bad. You need to stop. So now we've, that stress.
So I would say that is actually potentially amplifying
absolutely
how our bodies then cope with other real world stresses.
Exactly. And kids, especially under the age of 3, they are learning how to read a face, right? So if you have a mask on, if you're covering half of your face, those children are not assimilating what your eyes, what your forehead, and what your mouth are doing all together.
Essentially, that means that we take a bilingual potential and make them unilingual.
Yeah.
Which is a discredit to the body's capabilities.
Absolutely. And so I kind of coined this thing where we were going to have, I predicted this back in 2020, that we were going to have a lot of social autism in children.
Oh, so define that for us.
So social autism is really where kids do not know how to interact with other human beings because...
And they're fine. They're
neurodevelopmentally normal. You would consider them normal.
Untrained.
But they socially cannot adapt to the human process.
Is there something under 3 years old that needs to happen, and can it be regained?
Well, that's where a lot of the embedding starts is infants bonding with their mom, right? And then you just keep going through, and the brain is very rudimentary. So in children, they're developing their brain back to front. Back is kind of the reptilian brain, as we call it, right? Up to the front, which is your thinking didactic brain, and then right to left, where you have integration. So you see like a newborn, for instance, right? They're kind of like flat on their back, arms are out, they shudder for everything. They get lots of reflexive activity. And then by the time they're 4 months old, they're smiling, they're bringing their hands to the center. This is all how the right and left start to come together. That's how and then they socially are starting to pay attention to someone talking with them, and they make eye contact, and that's the back to the front starting to come together. So it's really cool to watch a kid develop.
Just hearing you explain it, I think gives rhyme and reason to how cool the brain is.
Oh yeah, it's an amazing organ, right? So and how did they learn that? Well, they learned that by a human adult looking at a human child, smiling, talking to them, giving them breaks. So if you actually talk to a baby, a 4-month-old baby, and you go, "Hey, how you doing?" and you just nod at them, they'll start to coo back at you.
They call it mirror neurons, right?
That is their first social interaction.
Oh.
Now do that with a mask on, right?
Yeah,
we both have we both have kids, right? And our daughters were together in school for a little bit.
And both our minds just went back to when we saw that.
Right.
It brings smiles to our face.
It does, right? Because you're like, "Oh, how cute."
Yeah.
This is why we don't eat our young right there, right?
Yes, good plan.
And so that's the first thing. But when you are in masks, they drift off. Like you can see it, that children can't pay attention to the human face anymore. It just is a very scary situation. And in pediatrics, they were all going crazy with these masks and, "Oh, it's all in your eyes." I'm like, no, it's in your entire face. You know nothing about development. And that's embarrassing on my point, right? So now we have these kids so this kind of develops through the second year of life, all that, putting it together. That's why kids open and shut a cabinet door 55 times. It drives us nuts as adults, but it's an experiential thing for a child, and they have to do it with repetition.
That's right.
So it's the same thing. Social interaction is repetition. Well, put people in masks, separate them. There's no social repetition. Nothing. And so then you develop this social autism because they can't, people in the, you probably experienced it if you go into the supermarket. People avoided people like the plague during that time.
That's right.
And especially
if they had no mask on,
they would run the other way. I mean, it was ridiculous.
I remember I went to one of the grocery stores. I walk in and I was confronted by two big people that were calling themselves managers, and they escorted me out. And I said, "Listen," I said, "you do understand what's happening here, right? Y'all have masks on. If they're protecting you, great. I just want to get some food for my family. That's all I'm after.
Yep.
And I'm not trying to cause trouble. I'll hold my breath." You know what I mean? But exactly. Please, let's not do this.
Yeah.
And don't get me wrong. My heart was pounding because I didn't want to get thrown out of a grocery store.
Exactly.
How dare me?
How crazy was that?
Yeah, for sure.
It was
in Texas.
Exactly. In Texas. Exactly. I mean, same thing happened to me. Same thing. But I actually called the manager over, because if you listen to what was going on overhead, that is brainwashing. You were hearing, I timed it. Every 10 minutes, there was a certain message that came through.
Yeah.
And so I called the manager over, and one of my patients actually was a checkout girl. And so I made a point to say, this is actually I don't appreciate you brainwashing my patient, because she's listening to this every 10 minutes, which is 6 times an hour. She probably works 4 to 8 hours. Multiply that out. That's brainwashing. You are delivering a message that, one, is untrue, and 2, you can't follow through on it. I mean, it was make sure you wash your hands. I said, "Do you have sinks on every aisle?"
Yeah.
Because if you don't, then this is a false statement.
Because now everybody's got to run to the bathroom.
There is no
bathroom.
But
Yeah.
silly.
Yeah, no, it's totally
Absolutely
right. Totally
ridiculous, right? So, that being said, that just caused the anxiety walking into the grocery store, unconsciously listening to this. Now, I was consciously listening to it because I wanted to see what was going on, but unconsciously, people are listening to this over and over again. The workers, the stalkers, because they were essential personnel.
Brilliant. If you're in the brainwashing business, it's brilliant.
Exactly.
Okay, so how then now, post-COVID, are we dealing with this social autism? How are we retraining the brain? How are we dealing with stress?
Well, the interesting thing is education has learned that this really backfired and smacked them in the face, which is really awesome. So, I don't like computers. I'm a tech tard.
I remember the day when tech overrode me as well. Now I don't know if I've hit tech tard level, but I hope not.
No, I'm serious. Give me a piece of paper and pen and I'm happy as
so much better. Yeah.
So much. I cannot stand EHRs, the whole thing.
Yes.
Just can't stand it. But so our kids stopped being social. And there's great studies. You can actually look and see what, semi-adulting in 12th graders in 2020 compared to in the 1970s and 80s. And their social interaction dropped like 60%. It just completely plummeted over these decades. And it's a planned course, right? Yeah. So these kids, try to hire a young person that has some social skills, that can think for themselves, that
or outside the box in any way.
Or, have some kind of spontaneous ideas. These are really tough things for kids now. They just don't do it anymore, And so that's a big problem when we're looking at
the future evolution of the generations.
Even 5-10 years from now.
For sure.
We have really ruined a lot of our future. We have kids that are now in therapy that should have never been in therapy.
Well, they say right now, most sports children or high levels not tech sports, but select or elect or whatever they call it, sports, have counselors.
Yeah,
it's more than 80% are going to counseling to deal with the intensity of the coach because they don't have the social ability that they think running horses or conditioning drills or punishment.
Exactly. They just don't understand. They were placed in this, and by semi fault of their own, right? Because if they were in public school during this time, that's all was plummeted down their throat. And now, luckily, especially in our area here, we are very blessed because we have tons of co-ops, tons of homeschooling parents. I could tell you, I looked at the numbers because I'm kind of that person. And in our ISD here locally, back in 2019, there was 44,000 plus students in our ISD. We now it went down to about 40,000. So they lost 4,000 patients. Students. People. I'm used to patients. Students from 2019 to 2021. And now they're slowly creeping up. So now it's at about 42,000 plus in our own district. Now, where did those other 2,000 people go from 2019? And we are a hugely growing population.
Sure.
The parents have figured it out. Take your kid out of public school if you want them to be a truly thinking entity. And I think that's amazing. And parents, some of them are like, I can't do that. I'm like, yes, you can.
You can.
We did it for 8 years. I know you did it. And so it's completely plausible. But that's one of the biggest things with social autism. We see these young kids who now need therapy that should have never been in therapy. And now we have these teenagers who can't even get into the workforce, don't even get driver's licenses because they're so fearful
of the road,
of the world.
Yeah.
Of the world around them.
It's almost like the elderly, how they stop driving.
Yeah.
And a lot of times they stop driving because they're afraid to drive over bridges. They're afraid to drive more than, outside of their local area. And it's because they've, the brain essentially atrophied, because of lack of stimulation and lack of good food sources.
Fear is taught.
Yes.
Fear is not an inherent thing. Fear is actually taught.
So what does this do? What is this fear? What are these thinking? What is it doing to the body? And what are some things people can do to kind of help themselves?
Super simple. I do this prescription all the time. walk outside for 20 minutes a day.
Bingo.
That's number one.
All right.
Number two, draw or journal before bed. Make a list. I tell my teenagers to do this all the time because they come in, their nails are bit down to the quick. You know, they're pulling their hair out, they're biting their lip. You know, they're just riddled.
These essentially are the cues that their body is in distress.
Absolutely.
From an adrenal stress perspective.
Absolutely. You know, we do a lot of other things too, like brain tap, which is it's the frequency training and the light therapy. We do lots of different things in our office. And so those are some things that I recommend. You know, those are really simple, doesn't cost a lot. Then I do the 3-circle approach to psychology, which basically is they get paper plates, literally just paper plates, because we know that 93% of what people worry about is completely out of our hands.
That's right.
So let's focus on the 7% and what are those solutions? So I actually have the kids do 3 white paper plates and write no control, some control, complete control, and make lists.
Okay.
And then they rip up the 2 plates that really are not in their control. If they cannot find a solution, that means it's not in their control. So sometimes they're moving things from the quasi.
Okay. So when you're watching this happen to one of your patients, do you see light bulbs going off right, left, and Sunday when they start to actually come to grips? Because I've always said, you know, the pen is the crowbar to the mind.
Absolutely.
And you can't embellish, you can't lie to yourself unless you're just a true sociopath. You know what I mean? So like when you put pen to paper, or in your case, pen to plate, what power? You know what I mean? And when you start writing and you start realizing what you're writing isn't that bad, there's this like light bulb that goes off that you go, oh, I can do it. Exactly. You know what I mean? It's that revelation moment where you go, oh my gosh, that's easy.
And it's not just the kids. I make the parents do it too, because, you know, they're also in this grip.
Absolutely.
You know, so it is a hot mess express for the whole family. And so what we try to do is like, hey, do this as a family activity. Go for the walk for 20 minutes a night. Get fresher foods. Stop eating processed foods. Do a family prep night and make a meal together. Make sure you're sitting at the table without phones every night. And I mean, we're all so busy. We're Americans. We're running around. Our kids are everywhere. We get it. I understand.
You get it. I get it. I mean, we're in it still.
But it takes effort.
That's right.
It takes effort to do it. But those are the kids that are very well adjusted. Those are the kids that
can handle the word no. They can be rejected and
they don't need a trophy
crumble.
For every activity.
Absolutely. You know, amazing concept. Yes, for sure. And I think that, I mean, it's simply stated. I mean, just going for walks. I tell some of the elderly folks that come in to see me, like, do you realize all you got to do is just go for 10 minutes down the road and come 10 minutes home. It trains you to walk. I was watching this guy teach some kettlebell and club bell activities. And one of the things that I felt like it was so simple, but he was just saying, you stand with your toes pointing forward. And I go, yeah, how many older folks do you see walking like a duck, right? And you go, what's up with that? Well, their nervous system is broken. They've trained it weak, and if they get back into some of these normal gait patterns, being even simply intentional with walking can be absolutely mind-boggling. And I mean, not mind-boggling, mind clarity for the brain. Right. And they even say 25 to 30 steps activates the lymphatics from head to foot. I mean, so why not do that? And I really love the idea of just getting back, because this just preaches to me as, because no phones at dinner, you know what I mean? Or simply sitting around and actually looking at everybody to play the plate game, the wins, we call it wins, challenges, and corrections, you know, and, you know, what went well today, what was a challenge today, and what can we do to make today better than yesterday, you know, and small winnable steps. Tell me a cool story, like, you know, like of somebody going through one of those processes and you would see what you would call a life changed,
you know,
for them and or their family.
You know, it's so funny because some of them will just do the forehead slap. Oh, you mean it's that simple? Yes, it really is.
It is that simple.
It's really that simple. And so that's really cool that you can help them, and they didn't have to enroll in counseling services for 6 months or whatever the case it may be. Of course, granted, some of our kids, we do have to do that. You know, there are some serious cases, But I think
we're talking again about like that 93% of the population do not need as much therapy as we might think.
Absolutely.
Or have been brainwashed to believe.
Yeah. And, we see kids, especially on the spectrum, autism spectrum. We have some of these kids that are brilliant in certain things and their strengths have not been touched, so to speak. And so when I tell them, what do you like to do? Do you like to draw? Do you like to write? Do you like to cursive write? Have you learned to cursive write? And if they
which is taken out of the public school today.
Yeah, don't even. Yeah.
I was trying to set her up. We won't get off track. Okay, keep going. That's good.
But some of those kids, you really start to see their verbal skills just blossom. You start to see when they come in the office, they used to be all contracted, looking down, not talking to you. They walk in the office, they're like, "Hey, Dr. Farella, how you doing today?" I'm like, "Oh, here we go." Yes.
Yes.
It's a win. So we see it across the board with a lot of our patients. Of course, you and I both have the same. Our patients seek us out. So that's a fantastic thing. But at the same time, sometimes they're kind of lost. They don't really know where to seek out the truth. They don't really understand. So the truth for them is a different truth because it's been programmed. So deprogramming.
Well, and when they come in to see us, they spend a small fraction of time and they walk back into the world where they're inundated with garbage.
Absolutely. And so a big portion of that is, do a family night, do a mom only with a one child night, do a dad only with one child night, rotate that. Doesn't have to be long. Go to the park. Have you seen a park lately? They're empty.
They're empty.
The kids aren't doing, and of course, even the cities and stuff are taking away dangerous toys, which drives me nuts. Everything is like, we have to put everyone in a bubble wrap, which is silly. So I tell them,
which is another setup for isolation in some respects. The nervous system demands fuel and stimulation.
Absolutely. So, we're seeing things where kids are trying different things that they would have never otherwise tried. Shutting off the Wi-Fi at night is huge for me. I tell everyone in my practice, you got to shut the Wi-Fi off. You got to get the kids off of social media.
Great.
Sometimes that's extremely difficult. I have 2 kids in college. All of their stuff comes through their phone. Same thing with high school. Stuff comes through their phone. It's really hard to take away your kid's phone, but I do it. Too bad.
Good for you.
But these are the things. Well,
honestly, what is that teaching them? That's teaching them, like, look, nothing really is going to happen good after midnight, the old saying, right? Yep. And the world operates in the daylight hours. So get used to it.
Exactly. So, are there wins? There's wins all the time. I can't really pinpoint. I have some really
these are
amazing things that happen that we do with other therapies. We've seen kids that were nonverbal become verbal. We've seen, that's just miraculous when you see stuff like that. We've seen kids that were in a shell just blossom. The next time I see them, it's a totally different kid. Like I didn't even recognize them. I'm like, oh, hey, that's you. Oh my goodness.
Right.
This is awesome. So those types of things are they're so empowering for a physician because it's not objective. It's not like, oh, I improved your test score from this to this. It's more of a win on the heart. And that's really why A Brighter Tomorrow was named A Brighter Tomorrow, because I wanted to win the hearts. Hey. I didn't really need to give them scripts. I just wanted their tomorrow to be brighter than their today.
That's right.
That was always my calling. That's the way I named my place. And that's really our philosophy.
Inch by inch is a cinch. Day by day, we can make things happen in such a way that we got to break out of this like microwave mentality. So it's a pseudo stress. If this pseudo umbrella of stress is put on you in timeline and deadline, and essentially what I just heard you say is, guys, it's day by day. It's one food choice. It's your life, your health, your choice. Like, what things can we do today to make it better than yesterday? So if you didn't go for a walk around the block, today's the day.
Absolutely.
Right? If you did eat refined sugars yesterday, well, today's the day not to.
Learn a new skill.
Learn a new skill.
Learn a new skill.
Drawing has been fun. Learning to draw on a digital platform media is definitely different than pencil and paper. And so there's really, the world is our oyster to keep engaging, and we just got to remember that we're worth it,
Absolutely.
to invest in. And well, tell me, like, okay, if there was one little secret nugget, one little thing that you really want to impart to people that's been on your heart lately to share with moms, dads, families, children, teens, especially, that go through the hormonal shifts of life to make today better than it was yesterday so tomorrow's brighter, what would it be?
Fake it till you make it. Right?
Hey.
Fake it till you make it. I mean, smile. I mean, we know that psychologically, if you smile more, I tell people smile on the phone.
Yes.
That drives them nuts, but I do that all the time.
That's right.
Like, smile on the phone because it shows in your voice. It shows in your demeanor. It changes your biochemistry. That is super simple to do.
Absolutely.
Walk around. You want to freak people out?
Smile.
Walk around the mall and smile and say, how are you doing today? Do that in practice, especially shy kids. I tell my kid, one of my daughters is very introverted. And I'm like, I need you to start talking to people. I need you to order your own food. I need you to do this. I need you to smile when you do it, and really that's a skill training.
It's interesting when I used to do talk preparation and stuff, I'd get in front of a mirror and I would practice the talk smiling. And another thing is, eye contact. So sometimes you're like, well, which eye do I hit? I always teach people, talk to the left eye. You're always speaking to the visual cortex, and you will find your messages more received if you're consistent in doing the smile, because I think it comes across in the voice, like you said, and the connection to the brain. And I think that's like our gateway to get to the heart where you're trying to capture. Woo! Guys, Dr. Farella, how can people find you if they want to come and see you, or if they just want to reach out and make a contact with some of the other therapies? Yeah,
so we have two websites. We have ABT, 4kids.com, and ABT, 4familywellness.com.
Cool. Awesome.
So you can find us there. Just Googling my name. Okay, well, maybe you won't find me on Google, but you could try. You could try. Our office is in Webster, Texas. It's a Brighter Tomorrow Pediatrics or a Brighter Tomorrow Family Health and Wellness. So we still have both names out there, just because we've rebranded. But we do all kinds of fun stuff. Very similar. We cross a lot of paths with our patients. And
I thought that it would be good to have you on the show, because I've been doing this little series on anxiety and stress, and it's nice to hear from for others to hear that I'm not this one crazy person saying these simple truths, and that they actually have weight and merit, and that they are valuable and teachable and trainable and well received when implemented, and on and on and on.
And non-pharmacological.
And very much non-pharmacological. No drugs, no surgery, man. Let's see how, and like you said, that high level percentage things, 90%, 93% of what you think you're worrying about, stressed about, will never happen.
Exactly.
You're worth investing in. Take care and know that it is your life, your health, your choice. And Dr. Farella and I are here to support you, root you on, and help you find a better, brighter tomorrow. So here today on the Dr. Chapa Wellness Show, my day has been made bright. I hope your day has been made bright, and may you be blessed tomorrow as you go out and do great and mighty things. So we'll check you next time on the Dr. Chapa Wellness Show.